Good afternoon. My name's Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is today's COVID-19 report for British Columbia. I want to acknowledge that we're honored to be on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nation. I wanted to note that this evening at 7:15, Vancouver Coastal Health will be having its virtual town hall. That will be CEO Mary Ackenhusen and Chief Medical Officer Dr. Patricia Daly fielding your questions, and it will be hosted by MLAs George Chow and Teresa Watt. We thank them and their guests for providing what should be a very helpful session. You can reach or watch the virtual town hall on the Government of BC's Facebook page or the Province of BC's YouTube channel. And if you don't have a chance to submit your questions ahead of time, you can ask your questions during the virtual town hall on the BC Government Facebook page. And so we encourage everyone to have a look tonight. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you and good afternoon. This is our COVID-19 update for May 25th, and it includes the 2 reporting periods since we had our last media update. So we had 5 new cases who tested positive for COVID-19 between Saturday and Sunday, and an additional 7 cases between Sunday and today. That brings our total of new cases of people who have tested positive in BC to 12, and our overall total to 2,530 people in BC. That includes 894 people in the Vancouver Coastal Health Region, 1,253 people in the Fraser Health Region, 127 people in the Vancouver Island Health Region, 194 people in the Interior Health Region, and 62 people in Northern Health. We continue to have 16 active outbreaks in our healthcare system, 14 of those in long-term care and assisted living and 2 in acute care units. There are no new outbreaks, and we do have, unfortunately, an additional 3 cases, bringing our total to 333 residents who have been affected in the healthcare system and 209 staff. We have no new community outbreaks. We're continuing to monitor and support at the facilities where we've had outbreaks in the past, including the most recent ones in a correctional facility at Mountain and Matsqui. It was a person who was between both of those facilities, and the outbreak investigation continues at both, as well as the more recent one related to the frozen fruit packing. And just to be clear, there has not been any reported cases of food or food packaging being associated with the transmission of COVID-19. And I have been receiving some questions about whether it's safe to eat the products of some of the facilities where we have had outbreaks, and the answer is yes, the food supply is safe and continues to be safe, including products from facilities where there have been outbreaks. In terms of our cases, we now have 267 active cases around the province, and of those, 37 people are in hospital right now, including 7 in critical care or ICU. Over the past 2 days, we have had an additional 4 people who have died from COVID-19 in British Columbia, all of them residents of long-term care, and that brings our total to 161 people who have passed away from COVID-19, and of course our condolences go to their families and to their care teams and the challenges that this virus has caused and the grief that it causes for all of our communities when our seniors and elders die from COVID-19. There are 2,102 people who have now fully recovered after testing positive. So a couple of things today. We have 1 week left in our survey, our province-wide survey, to gather your feedback called Your Story, Our Future. We have over 313,000 people who have answered so far, but we are still encouraging anyone who has not completed the survey that you can do it both online on the BC CDC website or by phone in many different languages. And we want to be sure to hear your story of your experiences during this pandemic so we can best understand where the needs are and the things that we have to do moving forward. And we are moving forward. And as we do that, we are starting the second week of our pandemic restart, and we are monitoring our pandemic in BC very closely, as well as that of the experiences across Canada and other parts of the world, so that we can continue to chart our course forward. We have made significant progress, as you can see, and I'm encouraged that our new cases, our new numbers continue to track low, although we still have ongoing challenges with our outbreaks, and we know that in those places where businesses have been up and running, we have had occasions where we've had introductions that have led to clusters and outbreaks as well. As we see many places now that are opening up, we may see a resurgence of new cases, and none of us want that. We need to keep our curve flat, and as flat as we possibly can, as we look to ease more restrictions later this summer. And we will be watching especially closely over the coming week. As we know, this is the first week of the incubation period, the 2-week incubation period, and I look forward to monitoring and providing some more of the data for you all next week that will help us understand where we've been as we've started this process. But the key to our success in this phase and in the future is all of us working together. We need to be coordinated, and we need to continue to take those measures that we have been taking to keep our families, ourselves, and our communities safe. Today is also the start of BC Paramedic Services Week, and I just want to recognize that these emergency first responders are an integral part of our health response and our communities. They are professionals that are with us from the moment we call 911 to when we get to hospital, and as part of our system of experts helping to protect us across our province, and as well, they work in our communities. We have had for the last, I think it's going on 5 years now, a community paramedicine program that has used the expertise of paramedics in communities across BC to prevent people from needing emergency services in the first place, and to engage with people in the community at home to help with their health assessments and to keep them safe. And I want to say thank you to my paramedic friends and the paramedic family across this province for all of the work that you do. In step with these efforts, of course, we continue to have our public health teams test, trace, and track the spread of COVID-19 so that we can put out any hotspots that arise as we're moving into this next phase of our pandemic here in BC. As you know, our frontline healthcare workers are providing the care we may need, and our scheduled surgeries have started up again. And other health professionals are also starting up back in our communities. And this is an important health response, and we will be ensuring that we are continuing to monitor and support our health professionals across the province. As individuals, we must also continue to keep doing our part. Our efforts are working, and we are making progress. People are doing the right things. We're following our rules for the safe social interactions, and we're taking necessary precautions. We are being thoughtful and careful as we're moving into this phase. And I really do take that as a positive sign that British Columbians have heeded our advice and that we are doing what we need to do to protect us all. I understand as well today there is a very high demand for our many provincial campgrounds. Also something I think is positive, and a reflection that we are taking to heart, that need to stay close to home this summer and to experience all the many beautiful places in our province. What is clear for all of us is that our success so far and our ability to ease restrictions relies on our shared commitment and effort, and we need that to continue. As we have said, that means working together, recognizing that we all have our own challenges and experiences, and continue to be tolerant and generous and respectful with each other. So let's keep going, let's keep doing what we need to do in a thoughtful and careful way, and keep being kind and being calm and staying safe.
Thank you very much, Dr. Henry. I wanted to join Dr. Henry on behalf of the whole province in expressing condolences to the families of the 4 people who have passed away since Saturday's briefing from COVID-19. All of them were in long-term care, all of them at a long-term care facility at Langley Lodge, and we think of them, we think of their caregivers, we think of their families today, and we want to express our condolences and our understanding of their sorrow. This is a very, very difficult time for everyone who's struggling with COVID-19 in BC, and we can't ever forget the cost. It's a good reminder of why we've taken such strong measures in BC. I just want to put it in context. Between 4,000 and 5,000 people have passed away in care homes in Ontario and Quebec from COVID-19. And that's not to make a comparison between the provinces. They've struggled with their COVID-19 pandemic. But what it tells us, I think, fundamentally, is the vulnerability to COVID-19 of people living in long-term care, and why we need to take the measures from the single site measure to our very strong measures, which are very difficult for people in terms of not having people visit in long-term care and in acute care, why those measures have to continue. It's a very, very difficult situation. The living of it is very difficult for families. And I want everybody to know, everyone in BC to know, that when they express concern to me, as people do on email frequently, that I absolutely hear and understand that it affects my family just as it affects many, many other families. And we are thinking of all of you and wanting to be supportive of all of you. But for the moment, it is not possible to change those policies around visiting, although they're constantly being reviewed, because we know of the consequences for families of people not being allowed to visit. But we also understand the safety that's required and the needs to be safe in our long-term care homes. And if anything else, the results that we see, in spite of a flattening of the curve in long-term care, an indication of that. I wanted to note that we have 37 people hospitalized. That's down 2 from Saturday's briefing. That's 19 in Fraser Health, 1 in Interior Health, 1 in Island Health, and 1 in Northern Health, and 15 in Vancouver Coastal Health, for a total of 37. 7 in critical care. That's also down 1. I wanted to note that in terms of emergency room visits, something we've briefed on, provided a briefing on consistently over the last number of weeks, over the 3 days since I talked about it on Thursday. Thursday, Friday, Saturday, it was 5,101 visits. On Thursday, 4,844 visits. On Friday, 5,102 visits. On Saturday, which are fairly consistent numbers. To put it in context again, it was just over 6,500 on May the 9th, and it dropped just under 3,000 at the beginning of April, emergency room visits. And so this reflects a new normal of emergency room visits, which is significantly up from the bottom at the beginning of April, and indicates people using, as they should, emergency room services when they need help. And we can encourage people who need to be in an emergency room to continue to go. I wanted to acknowledge that we had 2 town halls last week, one in Island Health that was chaired by or emceed by Ronna Ray Leonard, the MLA for the Comox Valley, and Norm Letnick, the opposition health critic. It involved CEO Kathy McNeil and Richard Stanwyck. It had 13,000 viewers. Fraser Health had its second town hall on virtual town hall on Friday, May 22nd, with 11,000 viewers. And we want to express our appreciation to Dr. Victoria Lee, Dr. Martin Lavoie, respectively the CEO and the Chief Medical Officer of Fraser Health, and MLA hosts Bob Deeth and Joan Isaacs for an equally impressive show. And I wanted to thank all the people who submitted helpful questions, and encourage everyone to join Vancouver Coastal Health's team tonight. In closing, I just wanted to say thank you to all people in BC. This is, by all accounts, it's certainly what I experienced in my neighborhood. Our first weekend of renewed social and economic context went well. Thank you to everyone who's helping get our BC Restart plan off to a strong start by starting on the best kind of footing, one where we stay 6 feet apart. As we enter week 2 of phase 2, it's up to each one of us on how we proceed. For some, our comfort zone includes getting a haircut. safely expanding our contacts, or visiting a local retailers. For others, it's holding off until we feel the time is right for us. For all of us, staying safe in this welcome phase 2 depends on each of us ensuring that our comfort zone includes physical distancing. I'll report on surgical renewal progress later this week, but right now it's weekends like the one we just had, every day really, where we continue to use the skills that Dr. Henry has taught us that gives surgical renewal its best chance to succeed. Every day we stay 100% committed to preventing a resurgence. Every day we remember that physical distancing saves lives and our actions spread that message and not the virus. Then we've done our job to help those in operating rooms do theirs. We all have a vitally important role. Our success in sticking with it, is what has brought us to this encouraging point in our COVID-19 effort. So again, to everyone in BC, thank you. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 2 périodes de référence de 24 heures chacune, soit celle de 23 et 24 mai et celle du 24 mai jusqu'au 25 mai en mi-journée. Nous sommes attristés d'annoncer 4 nouveaux décès liés au COVID-19 dans la région de santé de Fraser, pour un total de 161 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Pour la première période de référence qui s'étend jusqu'au 24 mai, nous avons eu 5 nouveaux cas. Au cours des dernières 24 heures, 7 nouveaux cas se sont ajoutés. Cela représente 12 nouveaux cas depuis notre dernière mise à jour samedi, pour un total de 2530 cas en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 37 personnes sont actuellement hospitalisées, dont 7 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Merci beaucoup. Thank you very much. We're happy to take your questions.